Hey everyone, this is Katie Guy. I'm one of the sleep case managers here at Ohio Sleep Treatment, and today we're going to be going over a few exercises that you can do at home in addition to wearing your oral appliance at night. These are great to help tone your muscles that you use to breathe, and as you can imagine, having obstructive sleep apnea, that can be a little more difficult for us. So we're going to go ahead and tone those up to try to improve your breathing throughout the night. So today we're going to be working on your tongue, your cheeks, and your jaw. And I actually have been using these exercises myself, and I've seen an improvement even throughout the day in my breathing. I feel like I'm breathing a lot more, and these exercises also are going to help your sinuses, so not only your airway but nasally you can breathe a little bit better as well. So let's go ahead and get started. So first, what we're going to do is start with our cheeks. I'm just going to do a little bit of massaging to warm up the area. So go ahead and put your index fingers, or all of your fingers, onto your cheeks there, and just go in a circular motion. You might notice some redness, at least on my face. My skin is pretty sensitive, so that's normal. I'm the one that always has a red face at the gym. Alright, so now we have that area warmed up, we're gonna try a pressure point on our face. So this will also help with the sinuses as well. So what you're going to do is bend your index fingers, use those knuckles, and press against your skin just outside your nostrils, both sides. You might notice some pain there. It is a pressure point, so that can be sensitive, but that's that's going to be normal. That's okay. You might also notice some of that pain running down into your lip, and that's okay as well. But we're just going to hold this pressure nice and even for about a minute, and just continue to breathe through your nose as you apply that pressure. Okay, and if you wanted to do that additionally, if you really like that exercise, you can just move your knuckles out slightly and do the same thing. Next we have the cheek exercise. So this is where you're going to use your right hand index finger. You're going to put it inside your mouth and apply pressure to your left cheek. Now, while you're pushing on your cheek, you also want to push back on your finger. So you're going to exercise that cheek muscle. And that can be kind of tricky. You're not really sure what that muscle is or how to do it. One way I like to think about it is almost like you're winking. So you try and wink, and you might notice that muscle pushing against your finger. That's what we want it to happen. So you're going to do that for 10 or 15 times on each side. And again, you want to feel that muscle pushing against your index finger. And do that 10 to 15 times on each side. Next one we're going to try is the tongue bite and swallow. So this will involve your tongue. We're going to stick your tongue out slightly outside of your teeth, bite down on it, and then while you're biting on your tongue, you're going to swallow. You might have something to swallow at first, but after a while it's just going to be you using your muscles without really swallowing anything. So you want to do that about 15 or 20 times. And then now additionally we want to stick out our tongue a little bit further and do the same thing 15 to 20 times. These next three exercises kind of go together. It all involves sticking your tongue out. So if you have anybody you want to stick your tongue out to, this is a good time to bring them in the room. So first one we're going to do is tongue to chin. This is where you're going to stick your tongue out and just try and touch your chin. Some people can, some people can't. It's not really important, just as long as you're doing that movement. We want to exercise those muscles. You'll do that about 15 to 20 times. Next you'll do your nose. So you'll want to try and have your tongue touch your nose. Same idea. You might not be able to touch your nose, but that's okay. Do that 15, 20 times. And the last tongue exercise is you're going to tilt your head back parallel to the ceiling and just stick your tongue straight out. See if you can touch the ceiling with your tongue. I can't. Maybe you can. Just take it in and out slowly. All three of these exercises, you want to try and do these movements slowly. And you'll do that one 15 to 20 times as well. Some people like to alternate these three exercises, so you might try going in order of chin, nose, ceiling. Chin, nose, ceiling, instead of just sticking with one direction for a while. It's up to you how you like to do it. How's everybody feeling? Is that good? All right. If you have any questions, go ahead and leave them in the comment section below. And you can also give us a call. Our number is 614-396-8286. You can also reach us by email, info@sleeptreatmentoh.com. And of course, we're on social media. You can follow us, like us. Our handle is Ohio Sleep. We're on Facebook, Instagram, and Twitter. So find us there. We're always posting additional educational and fun videos there. Other than that, have a good rest of your day and sleep well.